Welcome to my presentation, Using Music and Psychedelic-Assisted Therapy in a Trauma-Informed and Culturally Humble Way. My name is Faith Halverson Ramos. As a board-certified music therapist and psychotherapist with almost 20 years of clinical experience working with people through all life stages, my clinical approach is informed by transpersonal, relational, and neurological frameworks, and I'm inspired by spirituality, expressive arts, liberation, and social justice. In psychedelic-assisted therapy, music can serve a variety of purposes, acting as a guide on the journey, a psychological resource, and a means of accessing emotions and memories that can be therapeutically relevant for integration. As such, music is considered to be an important element of psychedelic-assisted therapy and can be incorporated into all three phases of treatment. As part of preparation, it can help establish safety, set intentions, and support the therapeutic alliance. During administration, music can guide the emotional and psychological experience, amplify therapeutic material, facilitate the emergence of autobiographical memories and possible ancestral or intergenerational content, and shape the overall course of the session. When used as part of integration, music can aid clients in recalling, processing, and making meaning of their experiences during the psychedelic session. Increasingly, studies show that the therapeutic alliance impacts treatment outcomes in psychedelic-assisted therapy, and because of the roles that music can serve in psychedelic-assisted therapy, I think it's important to consider music within the context of the therapeutic alliance. When used in a client-centered way, music can contribute to this therapeutic alliance by helping inform the treatment setting and the client's experience. As a therapist, I believe that true client-centered care must be trauma-informed and culturally humble. This is because while music can be supportive in psychedelic-assisted therapy, it can also trigger trauma responses that are based on one's musical associations, sense of identity, cultural background, and lived experiences. Likewise, music can serve to celebrate or to help one to reconnect with their cultural background. Together, these factors and associations can shape how music is experienced in psychedelic-assisted therapy and influence the meaning that people derive from it. Knowing what these meanings and associations are for clients, or knowing how to account for these meanings and associations, can be useful for practitioners of psychedelic-assisted therapy as they identify how and what kind of music to use in their work. As an artifact of culture, music contains meanings and associations unique to the individual, and early protocols for using music in psychedelic-assisted therapy considered a person's cultural background and musical preferences, but later approaches prioritized the emotional content of music and moved towards standardized playlists that sought to avoid familiar music out of a desire to minimize pre-existing associations that a person may have with a song. However, a recent phenomenological study by Dwyer et al. In 2025 found that music, even music that may be familiar to a person, is experienced and perceived much differently when under the acute effects of psychedelics. It's also important to note that, much like today, the backgrounds of people who participated in early psychedelic research was largely homogeneous, so the cultural context and appreciation of the music used in those early studies was likely somewhat shared. Additionally, our understandings of trauma, what activates trauma responses, and how to treat trauma has evolved since these early days of research. With the recent psychedelic renaissance, there has been a need identified for integrating trauma-informed and culturally humble approaches to psychedelic-assisted therapy practice. And this extends to the ways in which music is used, as some have expressed critiques of the conventional use of music in psychedelic-assisted therapy through curated and sequenced playlists. For example, a case study by Rakovic et al. In 2023 pointed out how the sequencing of music could be experienced as coercive and the music used as reflecting colonialist perspectives. Additionally, they point out that curated playlists that lack consideration of the client or input from the client creates an unequal power dynamic between the curator of the playlist and the client. Lastly, they suggest that for some people, the use of different songs from different genres of music can be experienced as jarring, which can take them out of their experience. While music is a cultural artifact, as a broader universal phenomenon, it also has health-promoting effects that make it worthy of further consideration for its use in psychedelic-assisted therapy, particularly from the context of trauma-informed care. Studies show that music has neurological, neurobiological, cognitive, affective, and relational effects that can be used to foster both physiological and psychological well-being. Music activates nearly all areas of the brain and can improve the connectivity between neural networks affected by mental health conditions such as major depressive disorder and trauma disorders. This is done through the process of auditory entrainment in which brain waves become synchronized by the music. Affected neural networks include the default mode network and the salience network. Affected neural circuitry includes the limbic system and those involved with reward, which I'll briefly overview in the next few slides. The default mode network is involved with self-referential thought, such as self-reflection and autobiographical memory, emotional processing, social interaction, and mental exploration. With depression, hyperconnectivity within the default mode network can contribute to rumination and negative self-referential thoughts. Exposure to trauma can contribute to difficulties with self-regulation, emotional regulation, memory processing, including autobiographical recall, and increased mind wandering. In this image, the yellow represents the main regions of the default mode network. And music can have an antidepressant effect because of how it normalizes connectivity between regions of the default mode network. Whereas the salience network is involved with detecting and prioritizing important stimuli in the environment and helps in being able to focus attention on relevant information while filtering out distractions. It's also involved with emotional processing. When under acute stress, such as that which can be experienced during a traumatic event or from the reliving of a traumatic event, the salience network contributes to hypervigilance and helps with moderating physiological arousal due to its association with the amygdala. This network helps with switching between the default mode network and the central executive network, which is involved with executive functioning, decision-making, and complex problem-solving. Music can help normalize the connectivity between these regions while also eliciting through its impact on the limbic system other cognitive and emotional responses, such as the recollection of memories and the expression of emotions. Additionally, as with psychedelics, music can promote neuroplasticity and evoke transpersonal or mystical experiences. The reward circuitry in the brain, also known as the mesocortical limbic circuit, is involved with pleasure, motivation, and reward processing. With depression, changes in this network can look like anhedonia, or the inability to experience pleasure. And because this network also includes the limbic system, changes in its connectivity due to trauma can contribute to emotional dysregulation and a heightened stress response. Through this circuit, listening to music that one likes, whether that's novel music, unfamiliar, or familiar music, can activate pleasurable and rewarding responses. As a result of this brain activity, neurotransmitters like dopamine, serotonin, and endogenous opioids get released, as well as hormones like oxytocin and endorphins, which all contribute to enhancing mood, reducing stress, relieving pain, and improving one's overall sense of well-being. However, because music's effects in this way are based on whether the person likes the music, it's important to note that music can also contribute to negative stress responses based on whether the person likes the music or if they have negative associations with the music or sounds that they're hearing. So because music can be both helpful or harmful depending on the person's subjective experience, I believe that it's important for psychedelic-assisted therapy practitioners to deepen their understanding and approach to how they use music in their work. That's why I'm sharing some of the conceptual framework I've been developing throughout my doctoral studies in music therapy. While there's increasingly more information being published on how music can affect the process of psychedelic-assisted therapy, I've observed a lack of clear guidance on how to use music in a comprehensive, client-centered way that takes a trauma-informed and culturally humble approach. Because, as I hope I've made the case for, music is not a one-size-fits-all approach, and as psychedelic-assisted therapy becomes more clinically accessible, practitioners need to understand how trauma-informed and culturally humble care applies to how music is approached and used in their work. By doing so, the risk of potential harm can be reduced while potentially increasing treatment efficacy. Therefore, the rest of this presentation will look at trauma-informed care, cultural humility, and how to integrate music into these approaches. I'll end the presentation with future directions I hope to take in researching the topics of music and psychedelic-assisted therapy. To begin, it's important to understand what trauma-informed care is. Trauma-informed care presumes that everyone has experienced trauma in some way or form. Therefore, trauma-informed care requires creating a sense of safety, collaborating with the client, and empowering the client in their care. Therefore, a trauma-informed approach to using music and psychedelic-assisted therapy requires that practitioners be mindful of potential triggers that clients might have and strive to avoid re-traumatization. Create environments in which clients can feel physically, emotionally, and psychologically safe, which includes considerations around the use of sound and silence. Approaching the selection of music in a collaborative way with the client that helps them to develop trust in the practitioner and the therapeutic process, thereby helping them to exercise autonomy and empowering them over the course of the direction of their treatment. Being aware of the session space and how it's treated for sound, how much can be heard from inside and outside the session space. Preparation is a good time to introduce this approach, and questions that support trauma-informed care are: what music feels safe to you? What music feels grounding to you? And what sounds should be avoided? Cultural humility also supports client-centered and trauma-informed care. It requires appreciating and respecting cultural differences, engaging in mutual learning and self-reflection, recognizing power imbalances and implicit biases, practicing reflexivity, and considering patients' beliefs and worldviews. Cultural humility requires that the practitioner be curious about the client and open to learning more about them and the context that brings them to treatment. The practitioner must be open to engaging in honest self-reflection on their feelings, behaviors, and responses towards their clients, as well as their own beliefs about music, the psychedelic experience, spirituality, or mystical experiences. It involves appreciating and respecting cultural experiences and engaging in ongoing learning, and it requires a recognition of the power imbalances that exist between the psychedelic-assisted therapy practitioner and the client. Regarding the selection and use of music, practitioners should be attentive to the cultural significance of music, recognizing that song choices and instrumentation can carry personal and collective meaning, evoke memories, and either support or alienate clients. Questions related to cultural humility that a practitioner can ask as part of the preparation process regarding music are there cultural, religious, or familial associations connected to certain music or sounds that you want to include? If so, what are they? And are there cultural, religious, familial, or trauma associations connected to certain music or sounds that you want to avoid? If so, what are they? Client-centered music selection that is trauma-informed and culturally humble requires more than preference checking. It requires relational preparation, cultural inquiry, and consent regarding sound. It involves the practitioners being open to honest self-reflection and curious about their clients' perspectives, beliefs, and worldviews. Some ways to apply music and psychedelic-assisted therapy in a trauma-informed and culturally humble way include gaining an understanding of the person's relationship with music and the associations they have with music. This could help practitioners better understand the client, who they are, and where they come from, while the client can also gain a greater sense of safety, trust, and collaboration. This can be done during preparation and help inform the music that's used or the way music is used during treatment. Providing a music-based experience during preparation to facilitate inner resourcing and support also contributes to cultivating a sense of safety, while also serving to empower the client and having the tools to draw on if or when they get confronted by emotionally challenging material that can arise during the psychedelic session. For the practitioner, it can include having an awareness of the role that music plays in different healing and spiritual practices, not to culturally appropriate or misappropriate, but to hold a broader understanding of the therapeutic and transpersonal experiences of music from outside of their own cultural background. For practitioners who feel comfortable with making music, it may involve being open to incorporating live music in their work, if that's something that resonates with the client. Related to this, it also means being aware of one's own biases about music, including the relationships between music and mystical or spiritual experiences and psychedelic experiences, so that the practitioner isn't imposing their beliefs onto the client. Lastly, a trauma-informed and culturally humble approach to using music in psychedelic-assisted therapy requires a discussion with the client about the incorporation of silence and being open to their preferences for music, sound, and silence in their treatment. By having a deeper appreciation for the unique and individualized ways that people respond to music, practitioners are able to put greater thought and intention into the music used in their work. This could enhance treatment outcomes because clients will more likely like the music, resonate with the music, and be open to what the music evokes. Kellen et al. In 2018 found that these three factors related to the person's subjective experience of the music contributed to treatment outcomes, further highlighting the importance that music can play in psychedelic-assisted therapy when provided in a truly client-centered way that takes a trauma-informed and culturally humble approach. As I come to the end of this presentation, two directions I'm interested in for future research are the use of music and integration and music and ketamine-assisted psychotherapy. Given the importance of integration, this is an area in need of more research. Both Agela and Bacha et al. Identify the use of music in receptive and active ways as a tool or approach for addressing integration. Suggestions they make include listening to the music from the session to discuss and process any experiences that were elicited by the music, singing and creating music, and dancing. So I'm interested in learning more about how these different musical activities can be used to support integration. Because some of these approaches are particularly well suited for group experiences, I'm also interested specifically in investigating music-based group integration sessions, which could be especially beneficial for people who don't have strong support systems, as well as studies suggest that group therapy is helpful for people from collectivist cultures, particularly when done in formats that incorporate mind-body skills, which active music making, singing, and dancing do. However, for my presentation, I'm proposing two studies looking specifically at the experience and use of music in ketamine-assisted psychotherapy, since this is currently the only federally legal form of psychedelic-assisted therapy in the United States. I want to learn more about patients' experiences and perceptions of the music that was used in their treatment and see how the music was introduced and selected, as well as find out whether they found the music to be helpful, harmful, or neutral. My second study will be with practitioners of ketamine-assisted psychotherapy, and I want to better understand their views of the role of music in their work, how they introduce music to their clients, and what factors inform their clinical decision-making for how they approach using music in their work. Now I'm at the end of my presentation, and I want to thank everyone who has supported me in being able to present on this topic today. Here are my references. I've included a QR code where you can access them on my website, faithhalversonramos.com.